In this section, we'll look at some of the connective tissue. Connective tissue is important for, in a way, keeping us together. As we'll see, I will go over several different types of connective tissue. Okay, test question, function. So function of connective tissue is to enclose and separate. It forms capsules around organs, separates one structure from another. For example, your muscles are separate from your veins, are separate from your arteries, are separate from nerves, are separate from lymphatic vessels, and so on. If you notice that these things are not necessarily connected, like artery isn't really connected to a vein, they're separate. And there's connective tissue that allows for that separation. Also, connective tissue allows one thing to be attached to another, like tendons attach muscle to bone, and ligaments will hold bone together. And then our skeletal system, the bone, support and movement. Also storage. Adipose tissue is a good example of that, where it's stored energy, and bone is good for storage of minerals such as calcium. Fat or adipose tissue is also good for cushioning and insulation. Blood, a liquid connective tissue, is good for transporting substances throughout your body. And then it allows for protection. Okay, some of our connective tissue cells protect us against microorganisms and toxins, and our bone will help protect our internal organs. Okay, so we're going to look at loose areolar connective tissue, adipose, dense connective tissue, and the two different forms of that, and then some cartilage, 3 different types of cartilage, bone, and then blood. So these are our different types of connective tissue we'll look at. Okay, loose, also known as areolar connective tissue, its function is to support and nourish. So here we have a histology slide of what that loose connective tissue looks like. It is found widely throughout your body, filling spaces between glands and muscles and nerves and so on. Also helps attach the skin to its underlying tissue. As you can see over here, there's the loose connective tissue. Adipose tissue, which is the fancy term for fat, function, insulation, energy storage, offers some protection, and it's found widely throughout the body, under the skin, around organs. Okay, dense collagenous connective tissue, its function has the ability to withstand a considerable amount of force. It does have great tensile strength. It is stretch resistant. So these are found in your tendons and ligaments. Also found in the dermis of skin and outer layer of blood vessels, which gives skin and blood vessels some toughness. Okay, so dense elastic connective tissue, just think of how elastic behaves. You can stretch it and then it will recoil back to where it came from. So the function allows tissue to stretch and recoil. It is found in vocal cords. So here you're seeing a picture of your vocal cords, and walls of large arteries, and in ligaments. Hyaline cartilage. This does allow for growth of long bone. We'll get to that when we get to our skeletal system. Quick version, when you're born as an infant, your bones are relatively hyaline cartilage. And that eventually matures over time, and the way we mature bone is by depositing calcium into it. And as that calcium is constantly being deposited into the hyaline cartilage, it slowly turns into form. As you can imagine, as you age, so from infant to, now you're age 5, now you're age 10, and now you're into your adult skeleton, your skeletal system is fully mature at some point in your adulthood. But when you're an infant, it's hyaline cartilage and ossifies over time. Ossification is the process of which calcium and minerals keep getting deposited in bone over time. So hyaline cartilage will allow for the growth of bone, gives it rigidity with some flexibility. One reason why kids tend to fall and just get right up, because they do have that rigidity with flexibility because there's still hyaline cartilage in them. Found in long bone, found in the rings of your respiratory system, that is in the trachea. Trachea is hyaline cartilage, which makes the trachea not collapsible. The tube stays open. And found on the articulating surface of bone and found in a baby's skeleton. Articulation is where two bones come together and make a joint. That's an articulation. So it's found on the ends of the bone. Okay, fibrocartilage is somewhat flexible and capable of withstanding considerable amount of pressure. Found in your intervertebral disc. That's over here. So your IVD found right there in between the bone. So the picture we're seeing there of bone, that's your lumbar vertebra. And in between those vertebral bones, you find the intervertebral disc, or IVD. And that is a tough structure. Okay, it's pretty tough. It's also found in some discs that you would find in the knee and in the jaw. I want to make a clinical comment on fibrocartilage. And do know this, be able to understand this concept as I talk about it clinically. If you look over here on our Cartesian plane, we have the y-axis and the x-axis. When you fall, like picture a motocross person, they jump on a ramp, land really hard, their butt hits the bike. That's a negative y-axis compression. Or you fall snowboarding or any kind of fall. Okay, that is a negative y-axis compression where the disc gets slammed together because of the jolt from the fall. That can injure the disc, and it can also injure the bone, the vertebral bone, and it can cause a compression fracture in the bone. So that is where the disc, which is strong, can so look right here as I draw this. So that area there and that area there can compress into itself. That's called a compression fracture because the disc is that strong. You would take an x-ray to verify that. Also, which we'll get more into this when we get to the skeletal system, inside the disc here is the nucleus pulposus, which can herniate, and that herniation can hurt some of that fibrocartilage. Also, the fibrocartilage can degenerate. Okay, so when you get degeneration or degenerative disc disease, you're going to get loss of height of that fibrocartilage. Again, we'll cover that in more detail when we get to the skeletal system. Okay, elastic cartilage, rigid yet flexible, returns to its original shape, found in the ear. Bone, its function, strength, support, protection, attachment for muscles and ligaments. Keep in mind, a muscle tapers into a tendon and attaches to bone. So there's bone, there's muscle, and there's your tendon. Okay, muscle